We are going to perform bone marrow aspiration biopsy. We usually do this procedure on the posterior superior iliac spine. We position patients on the prone, asking them to lay on their belly. You could do it on the left lateral as well. If you put your hands on the patient's hip, where your thumbs lands is usually posterior superior iliac spine. Don't go medial because you could, like in patients who are thrombocytopenic or are anticoagulation, they could develop epidural hematoma. So cleaning with alcohol swabs, start from the center and go to the periphery. We could do bone aspiration on the sternum, but not biopsy. There is a risk for puncture in the heart. You could do bone aspiration biopsy on the anterior tibia in children. We use sterile techniques, so obviously cleaning the area, using surgical gloves. Three things could happen: infection, pain, and some bruising or bleeding, particularly in patients who have severe thrombocytopenia or anticoagulation. To prepare your tray, we use a 10 ml syringe for local anesthesia, and then 3 20 ml syringes, one for bone marrow aspirate. The first pool usually goes for morphology and MRD. Second pool for cytogenetics, fish and molecular studies, and the third pool we add heparin and we send it for immunophenotyping, flow cytometry immunophenotyping. Very good. Let's get some local anesthesia. It's better to combine 1 ml of bicarb with 9 ml of lidocaine. Yes, when you add bicarb, it reduces like the burning sensation patients could have. Very good. You could use up to 20 ml, 1% lidocaine for like a 70 kilogram patient. Very good. And up to 10 ml of 2% lidocaine. Lidocaine is a safe drug. If it gets to the bloodstream, patients could feel some like dizziness, nausea, vomiting. Otherwise, it's safe. Okay, first we use a hypodermic needle, sharp scratcher. Okay, needle is out. Another scratch. Always suction back, make sure that there is no blood, and then slowly go down until you touch the bone. Some patients have a bigger gluteus maximus muscle and you can't reach the bone. You could use a lumbar puncture needle. Periosteum is very pain sensitive. Sharp scratch. Can you feel my needle?
No.
Okay, very good. So it's working. Okay, needle is out. Use a scalpel to make a short cut, then you would not do a skin biopsy. And then we wait a couple of minutes until the local anesthesia starts. So we use a Jamshidi needle. Jamshidi was a hematologist oncologist who invented this needle in early 70s. He was working at a VA hospital in Minneapolis, Minnesota. He's retired now, actually lives in California. So first we do the aspiration. We are going to start deep and slow breathing helps, sir. Deep and slow breathing. The first pool goes for morphology and MRD. 1, 2, 3. When I suck the marrow, you might feel some pain on number 3. 1, 2, 3. Okay, very good. Second pool goes for cytogenetics, fish and molecular studies. 1, 2, 3. No, not yet. And third pool, which has heparin in it, goes for flow cytometry immunophenotyping. Okay. Needle is out. I've done the first part, which was taking the fluid part out, bone marrow aspirate. Okay. Getting ready for the second part, which is the biopsy. So as soon as you sit on the bone, you take your stylet out, and then clockwise, counterclockwise, scratch the bone and bone marrow into your needle. Be smooth and gentle. Okay, needle it out. Let's see what we have got. Okay, I'm ready for. Okay, very good. Here you go. So we have got, it's done. It's over. We have done good sample. Now we are going to prepare something we call it Touch Imprint. Very good. Yes. You are going to feel some pain in 2 hours' time when the effect of the local anesthesia wears off. Just take 2 Tylenols. You could put an ice pack on it. No shower tonight. Keep the area dry and clean until tomorrow morning. Okay, now slowly turn around and lay on your back for about 10 minutes. And always get rid of your sharps, please. Safety is important. How was it?
Not bad.
You are brave. Muy valiente.